Welcome to Please Me, the award-winning bilingual sexuality podcast bringing you bold conversations and big clit energy. Sí, Please Me tiene subtítulos en español. I'm thrilled to announce that Please Me is the #1 ranked sexuality podcast in the USA and worldwide. And welcome to Season 6. I'm Eve, your host, on a journey from trauma to sexual liberation. Join me and my guests as we dive into conversations around orgasm equality, self-love, body positivity, and essential sex education. Let's reclaim pleasure and close the orgasm gap, one empowering conversation at a time. On Wednesday, I was joined by Karen Bigman, the fearless midlife sexpert on a mission, for a powerful talk on sex, relationships, and intimacy after 50. If that speaks to you, go give it a listen. Today, I'm bringing back the webinar, Let's Talk Girth, Length, and Health, a no BS Q&A for men. This one's for the men out there and the women who love them. Huge thanks to everyone who's rated, reviewed, and shared Please Me. Because of you, we're now the #1 sexuality podcast in the USA and worldwide. Your support amplifies vital conversations about pleasure, healing, and sexual empowerment. Keep the momentum going, leave a review, share your favorite episode, and help us reach even more listeners. This week, I'm shouting out 5 amazing countries where Please Me hit #1. Latvia, Luxembourg, Saudi Arabia, Romania, and España. Thank you for tuning in and turning up the volume on pleasure. I'm also raising funds for survivors of the devastating magnitude 6.9 earthquake in the Philippines. My editor, who is based there, and her community were deeply affected. She recommended a trusted organization that provides long-term aid to those impacted. Please check the show notes for the donation link. Any support you can give is truly appreciated. Want to ask me a question for the Please Me podcast? Join the conversation on Patreon or subscribe to my Substack newsletter. Both communities give you access to exclusive content, updates, and the chance to have your questions featured on the show. Please Me is for mature audiences, so sit back, relax, and surrender to the pleasure of Please Me. And I'm just going to show you how it works here. I'm just going to turn it on. And it's very easy. It's just an on button, and then there's a plus and minus. And the plus is for more intensity, and then the minus is obviously to decrease the intensity of the suction. And right now it's on number 8. It goes up to 10, and you can see that it causes a really nice suction. And so when you wear it for 10 minutes, which is what I recommend to my patients, 10 minutes a day as part of their penis exercises, right? You go to the gym and work out. Well, this is your workout for your penis. Good morning, everyone. Welcome. I'm going to wait a couple of minutes and then I'll get started right at 12 o'clock, okay? We have a couple minutes and then we will get started. I would love to hear where you're coming from and what interested you in this topic. Why are you joining us today, or joining me today, I should say? I should have brought my water in here. I just realized I don't have it, but that's okay. If I get thirsty, I'll just go grab it. So how's everybody doing today? Welcome to the webinar. I'll be starting in just a minute. So this webinar is going to be recorded, and there's a new, at least new that I've noticed, spot for webinars. If you go to the tab with the chat room, and you scroll down, there's a button on there somewhere that says webinars, and then you can see all the list of webinars that are coming up, and also ones that have already been completed. So I know I have lots of videos on my profile, and sometimes they're really hard to find, the most recent webinar. So you can go to that part of SDC, again, on the right-hand side, the chat room, where it says live and chat room. Click on that, and if you scroll down a little bit, you'll be able to find the previous webinars and the ones that are coming up. And then you can find this webinar again if you want to share it with somebody, or if there's one that you missed that you want to check out. So welcome. My name is Eve Hall. I'm a licensed physical therapist that treats the pelvic floor and sexual health conditions. I also have a podcast called Please Me, and Please Me aims to destigmatize conversations about sex and sexual health. So I love coming on here to sdc.com and doing these live webinars for you, because I love to educate people about sexual health, sexuality, and just talk about lots of fun things in general. So SDC is definitely my home base for these live webinars. And today we are going to be talking about girth, length, and health, a no BS Q&A for men. And I would love to know where you're coming from today and also what interests you in this topic. Like I mentioned before, I have a podcast and it's called Please Me. And I just started season 6 of the podcast. I interviewed a gentleman by the name of Sam Itzaki, and he taught me a few things that I wanted to share with you guys, in addition to what I was already going to talk about, which is sexual health for men. And some of the things that he and I talked about, we did a 2-part episode that actually was just released this week on Monday and Wednesday. So go check those episodes out. We talked about prevention, a lot of things, a lot of issues such as erectile dysfunction or premature ejaculation can be helped with preventative measures. And so we talked a lot about prevention and what are the things that can help men to prevent these issues from happening. And in my practice, Inspire Health Physical Therapy and Wellness, I treat sexual health conditions like erectile dysfunction and premature ejaculation, among other issues. I also treat a lot of women's conditions as well, but we're going to be talking about men's conditions today. And one of the treatments that I do, I've spoken about on SDC.com before, is acoustic wave therapy. And acoustic wave therapy is the gold standard for treatment of erectile dysfunction. But I also want to say that it's also the gold standard for prevention of erectile dysfunction. And what it does is if you have blockages in the blood vessels in and around your penis, what it does is it unblocks those blood vessels. It's little shock waves that go into the tissue and it unblocks those blood vessels, and it allows for those blockages to flow safely away. And it also, over time, when you do multiple treatments, it helps to increase capillary formation. And capillaries are the tiny little blood vessels that go to all the areas of your body, including your penis. And that's what pumps it up with blood. And so if those little blood vessels are blocked, and they can become blocked depending on your nutrition, etc., then you can start to have some erectile dysfunction symptoms, such as no more morning wood, less erections throughout the night, less erections throughout the day. If you think about your function when you were a teenager, the wind would blow, and you would have an erection. And those spontaneous erections slowly diminish over time. 20% of men in their 20s have some form of erectile dysfunction already, and it goes up 10% per decade. So 30% in their 30s, 40% in their 40s, 50% in their 50s, etc. So by the time men are 50% of them have some form of erectile dysfunction. So that's why I love to talk about prevention, because there are so many things that we can do to prevent these issues from occurring. And one of those treatments is the acoustic wave therapy that I just mentioned. It's sort of like if you've ever gotten an ultrasound, it's like an ultrasound wand, and the same gel is used, and the wand is sort of rubbed along the tissue in and around the penis, on the penis, and in the perineum, which is the space between the anus and the base of the penis. So you get lots and lots of blood flow to the area, and that helps to unblock any blockages you may have. So that's one treatment that I do in my clinic. Hi there, Light Tree. Please mention where you're from in the chat. And if you have any questions, feel free to put them in the chat. I will answer them as I go along or at the very end. So don't be shy and ask your questions. So we talked about acoustic wave therapy a little bit already. And I want to talk about dry needling. Is anyone familiar with acupuncture? So acupuncture is the Eastern version of needling, right? And the Western version is called dry needling, and it's very similar to acupuncture. The same needles are used, and there's a protocol that I use for my patients to help increase blood flow. And acupuncture has been proven to increase blood flow. And so a lot of the same points from acupuncture are used in dry needling. And so I do dry needling on my patients as well. And you can do that in conjunction with acoustic wave therapy or separate from acoustic wave therapy, but they both work hand in hand to decrease erectile dysfunction or to prevent erectile dysfunction or premature ejaculation. You can message me those questions about pricing because I'm not going to talk about that right now. But if you're interested, message me directly right here on SDC and we can talk about that. Okay. So yes, there's a lot of different medications that you can take to help with erections, right? The little blue pills, Viagra and Cialis. But unfortunately, those pills come with a lot of side effects. And also they mask the symptoms of the actual issue. And the actual issue can be multifold. It can be psychological. It also can be physical. And so the physical manifestations of these issues are what I treat in my practice. And like I mentioned before, blockages can cause a decrease in blood flow to the penis and the surrounding tissue. So can penis leak, okay? And penile leak is basically when the penis does get blood flow and it gets full of blood and then it slowly leaks out and the penis doesn't stay hard. And that's very common as men get older and the muscles in that area start to atrophy. And when the muscles continue to atrophy, you can have something called penile shrinkage. And penile shrinkage is something that can occur, that will occur with most men, unless you are actively trying to make sure that you are working those muscles so that they don't shrink. And if you think about any muscle, if you don't use the muscle, it eventually will atrophy. So you have to use the muscles regularly. So what I do recommend to my patients and what is part of the protocol is masturbating at least 21 to 22 times per month. And what that does is it helps to increase the blood flow. It gets you to practice using those muscles on a regular basis so that you don't atrophy those muscles. And it helps with, if you incorporate edging, you can also learn to teach yourself to last longer for greater pleasure. And greater pleasure is always a good thing. So yes, one of the things that that are part of my protocol are penis pumps. So when a patient comes to see me, we will do the acoustic wave therapy, but I have a whole protocol of things that I do. And penis pumps are excellent for increasing girth, for maintaining the health of the penis, because what you're doing is you're practicing really engorging the penis and getting it full of blood. So this is very, very important. And so one of the things that I spoke about, like I mentioned in this week's episode with Sam Itzaki, was a special penis pump that he actually sells. And he sent me some penis pumps so that I can share them with you. And what I absolutely love about this particular pump is that it has 4 different sizes. And I know that some of my previous patients had ordered the penis pump that I had recommended off my website, pleaseme.online. I have lots of beautiful toys and etc. on there. And unfortunately, the penis pump that I have on my website only has 1 size. And so if it's too big, what can happen is that the testicles can get pulled in with the pump and it can be very painful. So you have to be very, very careful with sizing. And what's great about this pump is that it comes in 4 different sizes. So you just have to measure yourself and order the appropriate size. And then, so I'm going to show it to you here. This is the penis pump, and this is one of the sizes, okay? And you can see this opening here. So what you want to do is if your penis, once it's pumped up, is touching like the whole circumference, then you're ready to graduate to the next size. And I'm going to show you the different sizes. That was a 2-inch. It also comes with a 1 3/4 inch, and it comes with, well, the pump you would buy with one size, and then if you wanted to get another size, you would just buy the cylinder container. So this is the 2 1/4 inch, and the last one is the 2 1/2 inch. And so these are the different sizes. And so this penis pump is amazing because it has different sizes. So you can measure yourself and get the appropriate size for yourself. And I'm just going to show you how it works here. I'm just going to turn it on. And it's very easy. It's just an on button, and then there's a plus and minus. And the plus is for more intensity. And then the minus is obviously to decrease the intensity of the suction. And right now it's on number 8. It goes up to 10, and you can see that it causes a really nice suction. And so when you wear it for 10 minutes, which is what I recommend to my patients, 10 minutes a day as part of their penis exercises, right? You go to the gym and work out. Well, this is your workout for your penis. You're going to get tons of blood flow to the area, and you're going to allow the muscles and the blood vessels to practice getting engorged. And so it's very important to practice because, like I said, you can develop penile shrinkage if you don't use those muscles and you don't use the body part, okay? So you can see that it's really sucking my hand here, and you can see it's getting really pink. Yes, it's very long. All of them are very long, but you would be surprised because the suction really sucks. It makes it even longer, and it pulls a lot of blood into, more so than if you were just regularly getting hard. So it's really, really, a great pump. So I'm going to turn it off here because it's actually kind of hurting my hands a little bit. But when I take it off, I want you to just look and see, just in that one, I don't know, minute or so, how much blood was there. Did you see how pink it was? And so I recommend that my patients wear their penis pump for 10 minutes per day. And then I also recommend that my patients masturbate every day. And incorporating edging can help to prolong your pleasure. And also practicing ejaculating is very important too. So you don't want to restrain the ejaculation. You also want to ejaculate. And when you ejaculate 21 more times per month, it decreases the risk of prostate cancer. And so that's why this is super, super important for men to understand that masturbation is actually very, very good for you. Even if you're in a relationship, that, the relationship is one thing and your relationship with your own body is another thing that you should always maintain, whether you're in a relationship or not. And so I definitely recommend that my patients masturbate on a daily basis. So let's see. I have a bunch of notes here, so I'm just going to take a look real quick. Good. Yes, edging is excellent. Excellent to teach your body how to last longer, because if you want to satisfy your partner, women need a lot more warm up first to even be prepared for penetration. And then it takes us much longer to reach orgasm. So you want to sort of last as long as possible, right? Thank you for the compliment. It's not meant to, be this big, but, some people are actually, so not every, not all penises are the same size, obviously, but some people have really large penises. So, but it doesn't have to pull all the way to the end. It can just pull, however long it pulls. You don't want your penis squished in there. That would be a problem. So just like when I took it off, the blood exited from my hand. So your penis has muscles that hold the blood in it. And I talked about penile leakage before. When those muscles get weak, the blood that's in the penis can leak out very easily. And sometimes that is a cause of erectile dysfunction. It's not necessarily that the blood isn't flowing in. It's that the penis is the muscles around the base of the penis are weak. And so it's not holding the blood in, and you get penile leakage. So the blood is slowly flowing out. So it really just depends on the person. But what can help with that is a cock ring. And a cock ring is really good to hold the blood in, and it helps in that moment. But it doesn't help to strengthen the muscles. So if you wanted to strengthen the muscles, you'd have to see a pelvic floor physical therapist, which is what I do. Let me just see if there's any other questions here. Yes. So penis pumps will help with girth. They will maybe also help with length too, but more girth than anything else. So if you use them on a regular basis, you will experience a bigger penis girth wise. So we are going to talk about length too. No, edging long is not bad at all. Any guidelines on how close to pumping the penis versus masturbating? So I recommend 10 minutes of using the pump a day. Masturbating, however long you want. Depends on how long it takes you to orgasm. I definitely recommend edging to kind of prolong the orgasm, just to train your body to last longer for more pleasure. And also ejaculating. So making sure that you finish the job. And however long that takes you. But the pump itself, 10 minutes per day. And Sam on the webinar, or I'm sorry, on the podcast episode of Please Me, he mentioned that you can start off with 10 minutes a day, but he sometimes has recommended that you work your way up to 20 minutes. So that is a possibility as well. I personally just usually tell my patients 10 minutes a day because I want them to be able to follow through on their homework. And I don't want it to be too much work so that they don't do it. We want to make sure that we're using these muscles all of the time. Okay, so let's see. You can do them back to back, or you can do them at separate times depending on, your schedule. So definitely, either way. Okay. Bathmate. So you can look that one up too. I'm not familiar with that pump. Yes. So the best pump to use is this pump. And I'm telling you why, because it comes with 4 different sizes. And sometimes you will get a pump and it's not the right size and your testicles can get pulled into the pump. So it's really important to get the right size. So I love that it has 4 sizes. So this is the second size up. This is the smallest size. You can see they're different sizes. And then this is the biggest size here. So it's really great to find the right size. And then once your penis has graduated to the next level, you just get another, this part, you get another one of these in the next size up, and then you gradually work your way up from there. So that is the penis pump that I recommend. And what I'll do is when I'm done here, I will set in, let me just see where I can put it. I'll send a message to everybody in the group chat with the link to this pump. And so let's just see. Yes, it does. It can make your penis bigger. It can make it thicker. No, you don't want to put the, the ring. Do you want to put it around your penis and your testicles? It depends on the ring. But yes, typically you want to put it around your testicles too, because otherwise it may fall off. So the one that I like to recommend is called Firm Tech. So let's talk a little bit about Firm Tech since you guys are asking about the cock ring. So Firm Tech is a really interesting company. I also interviewed the creator of Firm Tech on my show. His name is Dr. Elliot Justin. So you can go and listen to that episode. And he created a cock ring that is digital. So what it can do is it can measure the amount of nocturnal erections that you have throughout the night. And why that is important is that as people get older, and they start experiencing erectile dysfunction, if you stop having nocturnal erections, that's a sign that you may have a heart attack or stroke. So knowing how many nocturnal erections is really, really important. This cock ring can also be used during sex. So it can also help you to monitor how long you're able to stay hard. And so it's useful in a lot of different ways. The way that I like to use it in my practice is I like to get a preliminary reading so that we know what our baseline is, where we're starting from. And as we're doing the treatment with the acoustic wave therapy, the dry needling, and then all of the homework that's given, we can see the changes that are made in the patient's body and their blood flow. So it's a really great diagnostic tool as well. So I will share the link of that pump as well, or not pump, the cock ring. It's an excellent cock ring. I think every man should have one to know how many nocturnal erections you're getting, because oftentimes the precursor to heart disease is actually erectile dysfunction. So it's a really good indicator that you may need to go see a cardiologist. So this pump, I can't remember the name of it. I'm going to have to look that up for you. Sorry. I have the box there, but let me just see if it's here. Dr. Joel Kaplan is the name of the pump. Is the name of the pump, but I'll share the link with you after this. That's the name of the pump. And that was the original creator. Now it's owned by Sam Itzhaki. Oh, Firm Tech. Yes, someone is familiar with Firm Tech here. It's an excellent cock ring. It's really useful for a lot of different things. So definitely recommend that as well. And I'll also include the link for Firm Tech. So, okay, you're from West Palm Beach. Nice. I'm not too far away. Dry needling. So we use a lot of the acupuncture points, actually. So there's some points on your wrist. There's some points on your ankles. And then I do a lot of points on the perineum, which is the space between the anus and the penis. So it's along different parts of your body. And it helps to increase the blood flow to your penis. So I believe that there's a video in my SDC profile where I have maybe some pictures or the actual dry needling that I do. I can't remember. I think it was pictures. I don't think it was actually I wasn't videoing myself doing the treatment, but I do think I took some pictures. So you can look and see where the needles are that I place for the blood flow treatment. I don't know about the water pumps. Somebody mentioned it before. You might want to reach out to them off of this webinar and you can ask them which one they use. The pump that I'm recommending is this one because I love that it has 4 different sizes. So that is the one that I will start recommending to my patients, because the one that I was recommending before only had one size, and a couple of different people did tell me that it also pulled their testicles in, and that was very painful. And so it wasn't able to be used because of that. You want to start with a really good first experience. And when your first experience is not good, then you're not going to continue, unfortunately. So we want to start with a good experience, which is really great. As to this one, having all the multiple sizes, so you don't have any issues from the get-go. Yes. Prostate massage is definitely healthy. I'm not talking about that today, but it's definitely, something that you can do. What I am going to talk about next is a penile extender. And this is for length, okay? This is if you want to grow more length. And this is completely off the subject, but I was watching this show the other day called Ancient Aliens. I don't know if anyone else is into this show, but I love this show. And they were talking about, the possible, ancient aliens that came to Earth, and they were very tall. And, it's believed that they were from Mars, and on Mars, there's less gravity. So they're actually much taller than humans, which I thought was super interesting. And it's all about the gravitational pull, right? And so if you think about a penis extender, this is a penis extender right here. And the penis goes in this way. This is the base. And then you push it together. And when you push it together, there's like a spring action. And then you put your penis, the head of the penis, through here. And then this part pulls down, and you hold the head of the penis in place with this strap right here. And this is all medical grade silicone. It's very good quality. And then, so you put your penis in there, you secure the head, you're pushing it in, and when you let go, it causes traction. And so the reason why I brought up the ancient aliens was not because I'm obsessed with aliens, because I am kind of obsessed with aliens, but it was because of the Mars and the Martians and them being taller, and because they had less gravitational pull. So if you are pulling on your penis, right, and you're actually extending it, okay, over the course of time, it's actually going to get longer, which is fascinating, amazing, and very practical and useful. And so you would wear this for 30 minutes at a time, and then you could wear it for a couple of hours a day, but you would do 30-minute increments. So 30 minutes on, then you could take it off for 30 minutes, then you can put it on for 30 minutes, and you could wear this under your clothes. It can be very discreet. You take it off when you don't need it, then you put it back on when you need it. And over the course of weeks and months, you will find that your penis can get longer. Now, this increases length, not as much girth. So if you wanted length and girth, you would use both this and the penis pump, okay? And these are ways that you can enhance your penis in a natural way without surgery, which I do not agree with. I do not believe in, unless you have something like a spinal cord injury where you really just can't perform anymore. Your function has completely been depleted or taken away from some kind of injury. Then I can see why you might get a surgery for, getting your penis hard. And there are things that you can put into the penis that would like pump it up and make it hard. But unless you are in a very severe situation, like I mentioned, a spinal cord injury or something like that, I don't recommend surgical procedures or even fillers, Botox, anything like that for the penis. You can definitely make changes naturally by using these products, the extenders and the penis pumps. And if you're having issues with premature ejaculation, or you want to prevent issues from premature ejaculation or erectile dysfunction, then I recommend getting treatment with a physical therapist and using the acoustic wave therapy, which we talked about before, or the dry needling, or a combination of both. Those are the things that I recommend to help enhance your penis and to continue to keep it active and healthy for a long time. So, okay. How effective is which one? The penile extender, which one are you asking about? Does length come at a sacrifice to girth with the pump? So the pump can help with length a little bit. It mostly helps with girth. The penis extender helps more with length. So if you wanted both, I would recommend using both. Some people just want length. Okay. And so then you would just use the extender, or some people just want girth and then they would just use the pump. So really it depends. Everybody's individual. Everyone has their own wants and needs and desires, right? And so those are the things that I recommend. And then you would choose which one would be most appropriate for you. But those are the things that I recommend for enhancing your penis length and enhancing your girth. So yes, you need to make sure that you're using them properly. And that's why I really love to help my patients to teach them how to do that. You can certainly buy one on your own and read the directions carefully. The most important thing for safety with the penis pump is getting the right size. So if you, are small, you're not going to get this size, right? You might get this size, and that's okay, And as your body grows, you will eventually reach the outer limits of the circumference of this, and then you will need to graduate to the next size. So safety wise, I think that is the most important thing to think about. Measuring your penis and then getting the correct size. And then the penis pump has 10 different suctions, starts from 1 and it goes to 10. So slowly working your way up. Don't jump to 10 on the first time. Start on 1, then maybe the next day go to 2, and gradually work your way up. It's just like anything else. You need to have a wearing schedule, and a wearing schedule basically just means that you're gradually working your way up to the maximum tolerance. And that doesn't necessarily mean number 10 maximum, but your maximum tolerance, what you can tolerate. So a wearing schedule is very important, slowly and gradually working your way up. Now the extender, it's a very light traction. It's not super, super hard of a pull. So if you see it when I push it in like this, and then it comes out, it gives you that little bit of pull. But it's not a super intense traction. So it's going to gently pull over time. And that's why you have to wear it for 30-minute increments. It's not going to happen in a shorter amount of time. You have to wear it for longer periods. What's really nice is that it has a lot of different places where you can kind of make it shorter or longer. These little metal things, they screw together, and there's longer ones so you can make it longer, or or you can take some off and make it shorter to fit you exactly right. And you have to make sure that you're fitting it exactly right so that it's doing the job that it's supposed to do. If you're not using the right size, if it's too strong, then it's not going to, or if it's too short, it's not going to pull enough. If it's too long, it may pull too much. So you want to, play around with the sizing and make sure that it's comfortable, that you can wear it for 30 minutes comfortably. If it's uncomfortable, then you probably need to adjust the sizing of it. So all of these webinars are recorded. So someone's asking me if you can have a copy of this webinar. So absolutely, all of these webinars are recorded, and they go right into my videos on my profile. And also, like I mentioned before, if you go to the live and the chat room button on the left side of the profile, in that area, somewhere in there, you'll see another button that says webinars. And then you scroll down and you'll see all of the upcoming webinars that are coming up that you may want to join and add your name to the list. And then there's also all of the webinars that have come before and are already finished. And those are the recordings of those webinars. So you can find that all of the webinars that I've done there as well. Or you can look in my videos. And for some reason, it's not organized by dates. It's kind of just like all over the place. So they're kind of hard to find when you go to the profile itself. But if you go to the webinars, it's easier to find there. So again, the extender is the same company, Joel Kaplan, and I'm going to, if you guys haven't joined the webinar and you're just listening, I suggest that you go afterwards to the webinar and click that that you joined the webinar. That way, when I send the message to the group, you will get all of the links that I am going to be sharing with you. And if for some reason you don't get them, then you can just reach out to me directly, and I'm happy to share that information with you via Messenger. I can send it just directly to you. So I want to talk a little bit about nutrition, because nutrition is so important to health. And 80% of health is nutrition, what you're actually putting in your body. So if you're putting in healthy foods that are going to help your blood vessels to be healthy, you're not going to have issues with blockages in your blood vessels. But if you're eating high cholesterol laden foods, sugar, a lot of sugars, and a lot of unhealthy fats or processed foods, then your blood vessels are going to become blocked. And that's what atherosclerosis is, right? You've all heard of this. It can cause you to have a heart attack, a stroke, a quadruple bypass, or a triple bypass, etc. That's what is being cleared up when you're having these bypass surgeries. It's taking the blockages out of those blood vessels. And the blood vessels in and around your heart are very large blood vessels. So they can actually get blocked a lot. A lot of things can accumulate in there. Unfortunately, we don't want that to happen, but the blood vessels in and around your penis are much smaller. So you're going to see blockages and issues with erectile function much sooner than you'll feel any issues with your heart. So if you are experiencing any kind of erectile dysfunction symptoms, or even premature ejaculation symptoms, these can be precursors to heart disease. So I always recommend that my patients, especially if they've been experiencing these issues for many years, to go see a cardiologist to make sure that their heart is good, and also to try the Firm Tech cock ring, because the Firm Tech cock ring gives you so much vital information about nocturnal erections. And it's normal to have erections throughout the night. When you have 0 erections overnight, that can be a sign that you are going to have a heart attack within the next 6 months. So it's a great tool to use to sort of give you some information about your general health. So nutrition is super important. One of the things that I love to recommend is that my patients eat lots of fruits and vegetables. And unfortunately, the American diet is not the greatest, right? And the typical American diet, a person eats 1.5 servings of fruits and vegetables per day. And we need at least 10 fruits and vegetables per day, the nutrition of 10 fruits and vegetables per day. And most people aren't getting that. So I do like to recommend a product called Juice Plus. Juice Plus is basically encapsulated produce. It's put in little capsules, or you can get it in gummy form, which is the kind that I like because I don't like to take a lot of capsules. But it's basically the same formulation, and it's produce that's been encapsulated and that you just drink down. You get the nutrition of 30 fruits and vegetables in your body every single day. And it's sort of like an easy button for nutrition. But, limiting other things like meats that have cholesterol in them, obviously all meats do, having fish on occasion, but not every single day as well. And then, eating lots of plant-based nutrition. So lots of fruits and vegetables. Of course, your carbohydrates should come from complex carbohydrates, not simple carbohydrates. So you want brown rice. You want quinoa. You want to avoid white bread, pasta. Those are simple carbohydrates. And so these are the things that you want to eat. And then lots of plant-based proteins, like you can have soy protein. There's lots of different kinds. You can also have lentils, beans, etc. Those sorts of things have lots of protein as well. So nutrition is super, super important for our health. It really is the number one thing that you can do to get healthier right away. When you change your nutrition, you're changing your body from head to toe. And what's incredible about our bodies is that all of the cells have to regenerate in our bodies. Otherwise, we'll die, right? And so I like to use the example of the tongue. The cells on our tongue turn over every 12 to 14 days. So, what you like now, in 2 weeks, you can change your taste buds in 2 weeks that easily. So if you're not used to eating lots of fruits and vegetables, I love to recommend the Juice Plus, like I mentioned before. What's amazing about the Juice Plus is that if you take it over the course of time, your body starts to crave the nutrition that you're giving it, and you start to crave fruits and vegetables, even if you are a person that has never eaten them or has eaten them sparingly in your life. So it's called metabolic reprogramming, and it's an amazing function of the Juice Plus that is, a bonus. Because, really you want to ingest the fruits and vegetables. That's the best way to get it when it's fresh. But if you don't eat fruits and vegetables, or you don't eat enough, it's a great way to bridge the gap between what you are eating and what you should be eating. So that's 80% of health. The other 20% is drinking enough water. So water is super important. You should always have half of your body weight in ounces. That's what I recommend. That's non-caffeinated beverages. And then exercise is extremely important as well, but that's part of the 20% of health. So 80% is nutrition, what you put in your body, and part of the 20% is exercise. And a lot of times people think, oh, I need to get healthy, I need to exercise, but they don't pay attention to their diet. The biggest change that you can make in your body is to put the right foods in your body. So nutrition is much more important than exercise. Exercise is important. I'm not saying it's not, but definitely nutrition is something that you should really focus on, and not just think about exercise, because that's a lot of times what people think about to get healthier. And yes, we're going to get stronger. Our muscles are going to get stronger. It's important to stay strong. And for penile function, right, to keep those penis muscles strong. And the penis muscles are smooth muscles. So you need to practice using those smooth muscles, or you will get penile atrophy. And the same happens with women. Vaginal atrophy is a real thing, and it can cause a lot of different issues as well. We're not talking about that today, but that's also something that can happen. Excuse me. And so atrophy is something that we want to fight against as we get older, because we want to make sure that our muscles stay strong so that you don't get the venous leak, right? The leaking of the blood that's coming into the penis, and then it's not holding in there. We want to keep those pelvic floor muscles strong in order to keep the blood in the penis when you're using it, right? So you want to prevent the venous leak by being strong in your pelvic floor, and then also using the smooth muscles by using the pump on a daily basis. That's what's going to exercise those muscles, as well as masturbation on a regular basis. And then, of course, having sex as often as you can, and that is always like the number one way to do it, right? But not everybody's having sex on a daily basis. And so you want to practice these other things when you're not. Yes. And fruits and vegetables also make your body fluids taste better. Pineapple's really good for that. I love to talk about watermelon, because watermelon has a natural chemical called citrulline, and citrulline is basically like a natural Viagra. And so I talk about the watermelon challenge. I know I've talked about it a lot on SDC in the past, and I'll tell you what it is. When you have 4 cups of watermelon per day for a week, okay, this is the watermelon challenge. I want you to do that, and I want you to see your erectile health and how it changes over the course of the week. Citrulline is a natural Viagra. It's in watermelon. So if you have 4 cups a day, you're going to notice a change over the course of the week. Now, if you find yellow watermelon, that's even better, because yellow watermelon, all you need is 1 cup of yellow watermelon, because it has 4 times the amount of natural citrulline in it. So you don't need as much. But either one is amazing. The yellow ones are hard to find. Sometimes you have to go on a quest to look for them and find them. And so the red ones are just fine. And most of the time you can find those in your local grocery stores, even year round, even when they're not available. And then there's lots of herbs that you can take as well, which I'm not going to go into that right now. But I do love to talk about the watermelon challenge. And yes, it makes your bodily fluids taste much better. So we have been going for about 45 minutes now, and I want to make sure that I leave some time for questions. So, pop your questions in the chat room, in the chat here, and I will definitely answer them. I'm here for you guys to answer any questions that you have right now. I want to talk to you a little bit about my podcast. My podcast, again, is called Please Me. This is what some of the thumbnails, some of the cover art for some of the episodes here. And it's in its 6th season now. I just started my 6th season this week. And actually the person that I interviewed, we did a 2-part episode, Sam Itzaki, and he's the one who talked to me about this amazing penis pump that has different sizes and the penis extender. So I was really excited to share this information with you guys. And so that's why I chose this topic for this webinar, because it was fascinating information, things that I hadn't discussed before. So I wanted to share that with you guys. So this week on Please Me, we did 2 episodes. One was released on Monday, one was released yesterday on Wednesday, and we talk all about all of this stuff. And what's really funny is that we also do a really fun role play. And this season, the role play is about the ick and what gives you the ick. And we talk about a really good one. I'm not going to give it up and tell you what it's about, but it's such a fun role play. And I think it's really common here, especially here on SDC. So I definitely recommend you go back and listen to those episodes. And also my show has been around for over 2 years now and is now the #1 sexuality podcast in the United States and globally. So I'm really proud of the work that I've been doing for the last couple of years, bringing sex education to the United States and globally. And, I'm always surprised at like all of the different countries that listen to the show and that the show has been #1 in. So it's incredible. There's, oh my gosh, I can't even tell you all of the different countries, but it really has been a beautiful journey and has shown me that, my purpose is to spread this education and to, teach people how to diminish shame so that they can have these conversations with their doctors, with their therapists, with their partners. Communication is so important in relationships and in getting the pleasure and the love that you deserve. And if you're not communicating your wants, your needs, your desires, your fantasies, your fetishes, you're not going to have the most amazing sex life that you can have. And that is what I want for every one of my listeners, and every one of my listeners on these webinars is to really have the most amazing sex life that you can have. And we talk a little bit on this past episode about big dick energy. Big dick energy is not necessarily about the size of your penis, although we talked about enhancing the size today. That's not necessarily about the size. It's about the confidence that you have in your sexuality. And when you have confidence in your sexuality, and, Sam on the episode talks a lot about how men, oftentimes their confidence comes from below the belt, right? And so that's why enhancement is such a big, topic for men, because they get their confidence from below the belt. So, we want to have that confidence in our sexuality, because that confidence translates to all areas of our life. It translates to the boardroom. It translates to giving webinars. And something that I coined on the show is the opposite, or the women's version of big dick energy, which is big clit energy. And that is my trademark. I talk all about big clit energy all the time and helping women to gain confidence in their sexuality. And, be able to ask for what they want in the bedroom and have these conversations with their partners. Because, sometimes they're awkward, but the more you have the conversations, the easier they get. So I don't see any other questions popping up here in the chat. I'm going to give you guys another opportunity to, to ask any questions that you may have. I think that I answered all of the ones that I was going to answer here from above. So the effectiveness of the pump and the penile extender, they're very effective to increase girth and to increase length. You have to use them on a regular basis. If you use them once and then you skip a week and then you use it another time, no, it has to be very consistent. Just like working out. When you go to the gym, you're not going to go once and then in a month you go another time, right? You go on a consistent basis, 3 times a week, 5 times a week. You want to also give your body time to rest. But with these, you can use them every day. And so the pump, like I said, I recommend every day for 10 minutes. The penis extender you can use on a daily basis for 30 minutes on, then 30 minutes off. And I would recommend up to 2 hours a day, maybe. But, in 30-minute increments. Now, the acoustic wave therapy is extremely, extremely effective in unblocking the blockages that you have in your penis and around the tissue. And so super effective. It's the gold standard in treatment for erectile dysfunction. But I would like to say that prevention is so important, because if you wait until it's so far gone that you are having massive issues and you're not even able to, penetrate with your penis, or it's just not getting hard enough at all, you're not having morning erections or morning wood, and you're having decreased nocturnal erections, then you really have waited too long, right? You want to prevent things from getting to that point. And when you treat something in its early stages, it's going to be much more effective than if you were to treat it when it's in its severe state. It's not that you can't make changes when it's in its severe state, but it's going to take longer and more treatments. So, for instance, my acoustic wave therapy clients, when they come to me, we decide whether they're there for prevention, and I recommend 6 visits for prevention, whether they're in the mild state of erectile dysfunction, and I recommend 10 sessions for mild, 14 for moderate, and 18 for severe erectile dysfunction. So depending on where you are in that continuum, we would discuss the symptoms you're having, and I would do a full evaluation, and then we would determine where you are in that continuum, and then I would recommend those amount of treatments. So yes, let's see. Yes. So we're talking about, it's not premature ejaculation. The definition of premature ejaculation is ejaculating sooner than 2 minutes. Okay, so that's premature ejaculation. If you can last longer than 2 minutes, then it's not considered premature ejaculation. But even still, if it's 3 or 5 minutes, it's not necessarily long enough, right? You want to last longer. So yes, I love to talk about edging. I think edging is a really great way to train your body to be able to last longer. So you basically masturbate, and I do recommend masturbating on a daily basis. That's part of the protocol that I give my patients. But for someone with premature ejaculation, I would ask them to masturbate for until they feel like they're about to ejaculate, and then stop. Let the sensation pass, and then start to masturbate again. And you do that over and over and over and over and over again, and you're training your body to last longer. Now, sometimes too, it's that the sensation is really, really sensitive. So you can use desensitizing creams to desensitize you as well, because sometimes the sensation is too much, and so it causes you to have premature ejaculation. So decreasing that sensation is something that you can also do with creams. For women, you can do just the opposite with a lube that I like to recommend called sex butter. and it has a little bit of peppermint in it. And the peppermint actually increases sensation. And this is really good if a woman has had, is in menopause or has decreased sensation for one reason or another. So, and most people as they age, if the circulation goes down, so does the sensation. So this lube is also really great if you have decreased sensation, because sometimes men will get to the point where they get hard and they can penetrate, but they can't actually ejaculate because they're not getting enough sensation. So the peppermint is actually really good for that as well. Yes, blood flow is very, very key to erectile function, and is really key to vaginal function too. The woman, the vagina and the clitoris and the vulva all needs to get engorged, just like the man's penis needs to get engorged with blood in order to be ready for penetration. So blood flow is essential for sex, period. So we need to really get that blood flowing initially, to really be able to enjoy sex to its fullest. So blood flow is extremely important. Yes, you can find a lot of information on YouTube. There is a woman that I follow, and actually she was a guest on my show. Actually, she's right here. And her name is Adrienne Grayson. You can follow her on Instagram. She is an herbalist, and her main focus is penile function. And she talks about the herbs that she uses. She sells different combinations of herbs for different things, but always about penile function. And she's really amazing. So I also recommend you go back and listen to that episode if you're interested in learning about herbs and natural remedies to help with penile function. So with that being said, I'm going to just give you guys another couple of minutes to ask questions. If you have questions about the treatment itself, or you're interested in talking to me about, doing a session, or you just want to have a consultation, please reach out to me here on SDC. Or if you're listening to this webinar later on, I will be using it later on. On my Patreon account. So, if you're listening to it later on, you can reach out to me on pleaseme.online. That is my website. I have a whole host of information on there. Lots of webinars that I've done in the past are there, as well as my store with lots of different beautiful toys, and information about some other products like the Juice Plus that I mentioned before. That's really, really amazing for helping you to increase your nutrition. And you can also go to the contacts page there. And under the contacts page, you can find all of my social media links. So you can follow me there so that you can keep up to date on what's going on with Please Me, the website, the podcast, and all of the webinars that I'm going to be doing in the future. And I typically come on to SDC once a month and do a webinar with you guys. So this is my month of September, and this one's all about erectile health. So I hope you guys enjoyed it. If you want to reach out to me, I also do, besides physical therapy, I also do health coaching, and I also do intimacy coaching for couples. So if that's something that you're interested in, I'd be happy to help you with that as well. And if you do listen to the show, and I definitely recommend that you at least go back and listen to the 2 episodes from this week, please leave a review. Reviews are how we grow and how we are able to spread our message to the rest of the world. So I appreciate everybody being on here today. Beetroot is extremely great for blood, okay? And papaya as well, but beets are excellent as well. You can juice them and you can drink them. They're really, really delicious. Or you can just eat beets, and I love them in salads with lots of other vegetables and fruit. So definitely lots of fruits and vegetables. So thank you for adding that. And again, my name is Eve Hall, and feel free to reach out to me on SDC here or listen to my podcast. Okay, until next time, guys. If you're feeling disconnected from your body, struggling with intimacy, or facing a sexual health condition, you're not alone. There is no shame in what you're experiencing, and you don't have to figure it out on your own. But the longer you wait, the harder it becomes to reclaim your confidence, pleasure, and connection. That's why I offer a free 15-minute discovery call to explore what's going on and whether working together is the right next step. Spots fill quickly, so don't wait. The link is in the show notes. Grab your time now.
Are you looking for a sexy date? Look no further than SDC.com. SDC.com is the premier ethically non-monogamous website that is worldwide. It also hosts a wealth of information on sexuality and sexual health, and I host a free live webinar monthly on the site. You can use code 37340 for a free trial membership on me, and be sure to reach out on the site and say hello.